Hello, so this video is about dialectical behavioral therapy, or DBT. So what is dialectical behavior therapy, DBT? Dialectical behavioral therapy is a type of talk therapy or psychotherapy. It's based on cognitive behavioral therapy, but it's specially adapted for people who experience emotions very intensely. Cognitive behavioral therapy is a type of talk therapy that helps people understand how thoughts affect emotions and behaviors. Dialectical means combining opposite ideas. DBT focuses on helping people accept the reality of their lives and their behaviors, as well as helping them learn to change their lives, including their unhelpful behaviors. Dialectical behavioral therapy was developed in the 1970s by Marsha Linehan, an American psychologist. So this is a picture of her. So, dialectical behavioral therapy, DBT, is a mix of CBT, behavioralism, and mindful practice, recognizing the importance of both and rational and the emotional realms of life. DBT seeks a middle path, inviting us to use our wise mind as the North Star when engaging with each other and the world. So, DBT combines interpersonal effectiveness, emotional regulation, distress tolerance, and mindfulness. So what is dialectical behavioral therapy used for? Dialectical behavioral therapy is especially effective for people who have difficulty managing and regulating their emotions. DBT has proven to be effective for treating and managing a wide range of mental health conditions, including borderline personality disorder, self-harm, suicidal behavior, post-traumatic stress disorder, substance use disorder, eating disorders, especially binge eating disorder and bulimia, depression, and anxiety. It's important to note that the reason DBT has proven effective for treating those conditions is that each of these conditions is thought to be associated with issues that result from unhealthy or problematic efforts to control intense negative emotions, rather than depending on efforts that cause problems for the person. DBT helps people learn healthier ways to cope. Okay, so how does dialectical behavioral therapy work? The main goal of therapists who use dialectical behavioral therapy is to strike a balance between validation, acceptance of who you are, and your challenges and the benefits of change. Your therapist will help you learn new skills and improve emotional regulation. The structure of DBT can vary some from therapist to therapist, but in general, DBT involves these four types of sessions. So you have DBT pre-assessment, individual therapy, skills training in groups, and telephone crisis coaching. So the acceptance parts are the mindfulness, being aware of the present moment without judgment, distress tolerance, managing your crisis without worsening the situation, accepting reality as it is, change, emotional regulation, understanding and reducing vulnerability to emotions and changing emotions, interpersonal effectiveness, getting needs met, maintaining relationships, increasing respect in relationships. So, individual DBT therapy. Individual DBT therapy involves weekly sessions with your therapist. Each session lasts about 40 minutes to 60 minutes. Individual DBT therapy sessions have the following goals: to help keep you safe by reducing suicidal and self-harming behaviors, if applicable, to limit behaviors that get in the way of productive therapy, to help you reach your goals and improve your quality of life by addressing what's blocking your progress, such as mental health conditions or relationship issues, to help you learn new skills to replace unhelpful behaviors. Your therapist will likely ask you to keep a diary to track your emotions and actions and to look for patterns of behavior. You'll bring this diary with you to your sessions, so you and your therapist can decide what to work on for each session. DBT skills training in groups. In these sessions, your therapist will teach you skills in a group setting. This isn't to be confused with group therapy, in which you discuss your problems with others. Think of it more of a teaching and learning session in a classroom setting. DBT skills aim to help enhance your capability in the day-to-day life. The 4 skills your therapist will teach you include mindfulness. This is the practice of being fully aware and focused in the present instead of worrying about the past or future. Distress tolerance. This involves understanding and managing your emotions in difficult or stressful situations without responding with harmful behaviors. Interpersonal effectiveness. This means understanding how to ask for what you want and need and setting boundaries while maintaining respect for yourself and others. Emotion regulation. This means understanding, being more aware of, and having more control over your emotions. Alright, so what are the benefits and risks of dialectical behavioral therapy? Dialectical behavioral therapy has been proven to help people with their mental health conditions in several studies. For people with borderline personality disorder in particular, DBT results in less self-harm behavior and anger, fewer days of inpatient hospitalization, less drug and alcohol misuse, improved depressive symptoms. However, DBT isn't for everyone, and it can be very difficult. DBT is more likely to work for you if you are committed to making positive changes, are ready to fully commit to therapy and do homework assignments, are ready to focus mostly on your present and future rather than your past, feel able to do some sessions in a group with others. So this is just an image I found that has some. So find inner strength with core mindfulness, build meaningful relationships with interpersonal effective skills, create daily peace with emotion regulation skills, maintain effective outcomes with the middle path skills, and reduce suffering with distress tolerance skills. So how long will I need dialectical behavior therapy? Dialectical behavior therapy, DBT, usually takes at least 6 months to a year. However, each person is unique, and mental health conditions are complex. You shouldn't expect to be completely free of symptoms or no longer have problematic behaviors after 1 year of DBT. Many therapists believe that the treatment for borderline personality disorder in particular can often take several years. Try not to get discouraged by how long it may take, and be able to better manage your emotions and have better quality of life. The important thing is that you're seeking help. Any progress is good progress.